we are going to be examining how individuals working as professionals in the public health system can collaborate to keep individuals and families who live in urban settings as healthy as possible. In order to do this, we need to be working from a common definition of what is health. In public health research, we often ask people this question in order to assess their self-reported health status or get a sense of their quality of life. The question often will read, in general, would you say that your health is excellent, very good, good, fair, or poor? So I'd like you to take a moment to answer this question for yourself if you were to have received a survey, either a phone call from a public health researcher, or if the survey was in the form of a paper survey at your primary care provider's office. How would you rate your health? So for some of you, that may be an easy answer. For others of you, it may be more difficult, or you might say, well, it depends. And so let's take a closer look at sort of the reasoning behind how people might answer this question. Think about why you answered the question the way that you did. For some people, they would say it depends because I just injured my back at work last week, and so I'm not feeling so healthy. But if you had asked me 2 weeks ago, I would have probably self-reported a better state of health. Another factor that may go into this is the idea of our perceived ideal health status. Sort of what do we see as the best definition of health, which we can aspire to? So our expectations become important, and the comparisons that we make between our health and that idealized health status. So we may compare ourselves to other family members. We may compare our health status to that of our friends, to our social networks, perhaps our coworkers, or to individuals that we come into contact with through media, for example. The other factor that may come into play is what we know about our own health. So if we've never been to a physician, we may think we're healthy when in fact we might not be. Or we may have recently visited our physician, and even though we don't think we're as healthy as we could be, our physician has told us that everything looks good. Either we don't have any diagnoses or medical conditions, or that we do have medical conditions, but that they're being well controlled. So for me, the important part of thinking about a definition of health is being self-reflective and understanding how our own experiences influence how we might report our own health. And that also then, by extension, helps us think more broadly about what factors do we think might impact the way someone else might answer the question. And that's what we're going to be thinking about as we explore definitions of health and how public health individuals can improve the health and well-being of urban populations.